as the coronavirus pandemic takes its toll on clinics and hospitals, some doctors and physicians have adopted telemedicine by using technology to reach their patients. Although telemedicine has been available for some years, its use has been limited in some way. But as the demand for healthcare systems boom as a result of the global pandemic, the use of telehealth applications continue to rise.
Recent statistics from the World Health Organization say coronavirus is the first pandemic in human history that has triggered the use of technology and social media on a large scale to keep people safe, productive, and connected while being physically apart. Before the COVID-19 pandemic, this was a regular sight at hospitals and clinics. But like lightning speed, the healthcare industry evolved, changing the way we seek care. Telemedicine is no longer seen as the future of healthcare, but the present.
Telemedicine simply means the use of modern-day technology to provide clinical care to patients remotely. And it has been proven to be a very cost-effective and time-efficient solution in addressing the healthcare deficits across the globe.
Telemedicine has been around for a while in many countries, but not so many accepted it until recently.
A lot of people were quite skeptical about the use of telemedicine, especially professional bodies and a lot of older physicians and healthcare professionals. However, the tide is kind of changing with regards to the fact that people are coming to see that most of the clinic visits that we kind of go for endlessly can be cut out by using telemedicine.
Although the World Health Organization has mentioned telemedicine amongst essential services in strengthening the health system response to COVID-19 policy, there are barriers to its implementation.
Across Africa, there's still no blueprint for the adoption of telemedicine, and that leaves a lot of loophole that needs to be urgently addressed. We need to have policies and guidelines that will guide, for instance, the licensing of the doctors, their qualification. You want to make sure that the doctors are currently in good standing with their regulators wherever they are practicing. You also want to make sure that the handling of the patient's medical record follows international guidelines and that they are not being compromised.
Telehealth has its limitations, but the technology can play a significant role in easing the strain on the healthcare system.
Beyond the cost savings, we also see that would help reduce the number of hospital visits, keeping the spaces in hospital for the people that really need it, reducing the waiting times for other people.
To reduce the risk of citizens contracting the disease, a number of online programs have been launched in Lagos State, like the ECO Telemed initiative to cater to issues not related to COVID-19, amongst others.
The COVID-19 Support and Surveillance Service is a consortium of 10 healthcare startups based in Lagos who have come together to create a system to support the primary healthcare system to help improve and accentuate the government's response on the community level.
We've launched a national telemedicine response to support Nigerians at this very difficult time. So we've launched an online screening tool that will help to assess a patient's risk of COVID infection.
While it may seem like all those long hours waiting at the hospital for medical care is over, telehealth is seen as a key technology for communication.